So a 58-year-old male comes to us with a complaint of palpitations and chest pain, and the ECG we had given, and the ECG clearly showed supraventricular tachycardia, and which all of you gave the correct answers. That was the atrial flutter. Now, in the coming session, we will talk about the basic pathophysiology of atrial flutter, how it's different from atrial tachycardia, how it's different from atrial fibrillation, what are the causes of flutter, what are the different types of flutter, and how will we treat the flutter. They're the macro reentrant atrial tachycardia, and the typical sawtooth wave pattern is seen, which is not seen in the case of atrial fibrillation or multifocal atrial tachycardia. And the main differentiating point between MAT and flutter is that in atrial flutter there is no isoelectric baseline. These flutter waves will never touch the isoelectric baseline, whereas in the MAT they will touch the isoelectric baseline. And all the flutter waves are exactly identical in nature, since they are in the same pattern they are produced. Now it can be of two types, that is cavo-tricuspid isthmus dependent flutter or independent flutter. Most common type is the CTI dependent flutter, in which the typical counterclockwise part which runs in the anti-clockwise direction, and the reverse typical is the one which runs in the clockwise direction. But both of these involve the cavo-tricuspid isthmus. In the CTI independent flutter, that's the atypical, they can either originate in the RA or in the LA, but they won't involve the cavo-tricuspid isthmus. Now, how to differentiate between the typical counterclockwise versus reverse typical clockwise flutter? So we will see the leads in the inferior leads 2-3 AVF and V1. In the typical counterclockwise flutter, the 2-3 AVF will have the negative waves and the V1 will have the positive waves. And just opposite in the reverse typical clockwise flutter, where there will be positive waves in the inferior leads and negative waves in the V1 leads. Now, talking about the cause of atrial flutter, it has all the same causes as AF. Whenever there will be the pathology of the right-sided heart, the atrial flutter can be produced. And talking about the treatment part, so before initiating the treatment protocol, we also use the Chadwell score in atrial flutter for the anticoagulation, like similarly we use in AF. And flutter can degenerate into fibrillation, and fibrillation can degenerate into flutter at any point of time. Even a single person can have flutter or fibrillation, but not at the same point of time. So talking about the treatment, so if the patient is hemodynamically stable or not, if the hemodynamic instability is there, then we will go for synchronized cardioversion. But if the patient is hemodynamically stable, then we will go for the rhythm control strategy. If it's possible, our method of preference will be electrical cardioversion. If not possible, then we can go with the rate control strategy, that is the beta blocker or diltiazem. If we are able to go with the electrological cardioversion, then low energy synchronized cardioversion will be used. But if the patient is having